for today is to try to make the whole Medicare maze sort of less complicated, so a little more black and white for you. One thing I do want to make mention is that Weiss Financial Ratings has absolutely no affiliation with any of these insurance companies, Medicare, Medicare Advantage, or again, like I said, any one of these insurance companies. We're simply here today just to give a little education and information based upon Medicare. I personally don't care whether you decide to just go at Medicare alone, whether you feel that the Medicare Advantage program is most appropriate for you, or if you decide that Medicare, Medigap is the right type of coverage to give you that comprehensive coverage. And more importantly, I could care less on, excuse me, I could care less on which insurance company you decide to go with. So with that being said, you know that I have no hidden agenda here other than to give you some great information. I've been a wealth manager for 31 years. I own my own wealth management firm for about 28. About 3 years ago, I decided to pump the brakes and stop working with some of my so demanding clients and really start working with wonderful librarians like Lisa, which is like a complete 180. I don't sell anything. I provide great information. And, am I a pure out expert on Medicare? No. Do I know enough to make me dangerous? Yeah, absolutely. The one person that I would say is the expert in this field, and everybody has access to it, and they are SHIP counselors. And whether the Osterville Village Library has access to some of these SHIP counselors, I know some of the town halls do as well. So if you have very specific needs, questions, or concerns, if I don't have the answers for you, SHIP counselors, this is what they do day in and day out. They're the marksmen when it comes to this. Okay. So I'm going to dive right in. Again, I'm going to apologize if you hear me cough or sneeze. I'm trying to get over a cold here, and I apologize for that. So the Medicare supplement insurance and how to pick the right plan and get the best rate. And we're going to also share a few Medigap secrets that may save you a bunch of money too. That's if Medigap is the right plan for you. The Medigap price and tool and insurance ratings. One of the key reasons why I work for Weiss Financial Ratings, I mentioned it earlier, is that we are independent. We have no affiliations with anybody else. Unbiased, like I said, I personally don't care who you decide to go with. That's your choice. And last, accurate. If you do decide to use this tool, the one thing I can tell you is our safety ratings and our pricing is very accurate. The Medicare Medigap discussion, it's designed to help you navigate through the Medicare maze. Our primary goal is to tell you about the choices you have available to you and help you save as much money as possible. At the end of this presentation, you'll be able to download your own customized Medigap report that can help you find and select the best Medicare supplement insurance policy for you with the strongest companies and for the least amount of money. And you know what? You could do it for free. Why? Because Osterville Village Public Library, they subscribe to this useful tool for you. Here's some of the things that we're going to cover today. And before I go any further, I just want to say, if you have any questions, let's hold the questions to the very end. Fairly certain a lot of the questions you may have will probably be answered throughout the presentation. I know at the end, I'm also going to show you an actual Medigap report so you could see one. And then we'll open it up for questions, and you could just use the chat and Lisa will let me know what type of questions are out there. So things we're going to cover today is major expenses that Medicare does not cover. When is open enrollment and what does that mean? Why Medigap can be better than Medicare Advantage. And I'm going to repeat that. Why Medigap can. It's not saying it is. It can be better than Medicare Advantage. And how to get low premiums, save hundreds, even thousands of dollars.
May I interrupt for one question that I think will help? Is Medigap the same as Medicare supplemental? Are those like interchangeable terms?
Yeah, so Medicare supplemental insurance is also known as Medigap. So uh,
Thank you.
you'll also hear that people use Medicare Advantage as Medicare supplemental as well. So that really using Medicare Advantage and the Medigap sort of completely segregates the two of them because they are two totally separate, coverages. When can you join Medicare? A 7-month initial enrollment period is either 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after your 65th birthday. The open enrollment period is October 15th through December 7th. If you're still working and covered by insurance, Medicare can also supplement your employer's coverage as well. We'll also be sharing these slides with everybody that has participated today. So if you're not a great note taker, you can have the slides. When can you change your plan or your insurer? If you have a Medigap plan right now and you want to change your plan or your insurer, you can do so during the open enrollment each year, again from October 15th to December 7th, and then your coverage will begin starting January 1st. Understanding Medicare coverage. The Medicare Part A is the hospital insurance, that's inpatient services. The Medicare Part B is your medical insurance, that's your outpatient, your primary care physician visits. And then you have your Medicare Part C, which is the Medicare Advantage. And then you have Medicare Part D, which is your prescription drug coverage. Medicare Part A. Okay, this covers the hospital-related services and emergency cares that I mentioned earlier on. Inpatient hospitalization, home health services, skilled nursing services, and hospice. Medicare Part A also does not cover all of your hospital costs, and it does not cover long-term care. Medicare Part B covers your regular medical care and helps with the outpatient services. Like I said, your doctor's office visits, PCP, primary care physician, the laboratory services, ambulance, and diagnostic services. So you might think you're totally covered after reading everything that Medicare provides for you. Medicare does not cover all of the costs associated with hospital and medical insurance, and it does not include prescription drug coverage. Here's some Medicare out-of-pocket costs for 2022. Now, this is also just been updated for 2023. It used to be Part A hospital deductible. If you spent day 1 through 60 in the hospital, it used to be $1,400. That actually has increased to $1,600. The Part A hospitalization, if you need to spend more than 60 days in a hospital, days 61 through 90, Medicare will cover only after you pay the first $400 per day. So again, we'll go back day 1 through 60. Medicare will kick in after you pay the initial $1,600 deductible, which is pretty steep. And then if you happen to spend more than 61 days in a hospital, it'll be $400 per day. So hypothetically, if it was $514 for the day, they'll cover $114. You're responsible for the first $400 per day. See how things can sort of mount up there. Now, God forbid you need to spend any more than 90 days in the hospital, 90 to 150. They'll cover anything over the first $800 per day that you're responsible for. So if it was $950 for the day, they'll cover $150. You're responsible to cover the first $800 per day. So this shows you just on how quickly things can certainly mount up financially for you. There are other hidden costs of Medicare. None of these things are covered. Prescription drug, vision, emergency care abroad, especially for anybody who travels, dental, and hearing aids. None of these things are covered. You have choices and individual needs, they'll vary. When Medicare was established back in 1965, it was never meant to cover all of your medical care for your senior years. It was intended to cover only the most basic of needs. And you do have choices in regards to your health care. I mean, you can simply just stick with the Medicare Part A and Part B, or you can purchase additional coverage, and you can make these decisions based on your own unique healthcare needs. And I always say the best way to do that is to start a conversation with your primary care physician to see what some of your needs may be as you get older. There are two choices to fill those gaps. One is the Medicare Advantage Part C, and the other is the Medicare Supplemental Insurance, better yet known as Medigap. Let's look at the two of them. Medicare Advantage Part C. Coverage is provided by private insurance and is limited to a defined network of doctors and providers. I need to repeat that. Medicare Advantage is a private insurance and it is limited to a defined network of doctors. So you do not have carte blanche of the doctors that you may be used to using all the time. It combines Part A and Part B of the Medicare, and oftentimes Part D, which is prescription drug coverage. So you do get some drug coverage in there as well. Now, the Medicare supplement insurance, better yet known as Medigap, it does cover those deductibles. Like I said, they'll cover the $1,600, the $400 per day, and the $800 per day after you pay the first $233 annual deductible. And it's designed to fill in the gaps. Again, that Medicare Part A and Part B just doesn't cover. Here's a side-by-side comparison on the Medigap, the original Medicare and Medicare supplement. Higher premiums, but no copays. You have the freedom to choose the doctors you like. No referrals are necessary. Now, the one negative is some routine services are not covered, like vision and hearing. One nice thing is that you're covered anywhere in the U.S. and actually 6 of the plans offer coverage abroad if you are a traveler. The Medicare Advantage plan. It's generally lower premiums, but they do have copays. Again, you may be restricted to a network of doctors. You may need referrals for specialists, and that can be a pain in the neck, literally. It may include extra benefits like vision, hearing, and even a fitness plan. Outside of your service area, you're only limited to emergency services only. So if you like to travel to New York, Chicago, California, Florida, or overseas, the only thing you're going to be covered for is emergency services only. Now, here's a secret one. Medigap plans, they offer identical coverage. Many people don't realize this. There are currently 10 Medigap plans, each known by a letter A to N, and 2 plans F and G actually have additional high deductible options. So the premiums are a little lower because they're a high deductible option. For every lettered plan, every insurer that offers the plan provides the same exact benefits. The plans are regulated by the government, so the coverage within each lettered plan is the same, regardless of which insurer you choose. That means all Plan A's have the same exact coverage. Plan B's, Plan F's, and Plan G's, they're all the same. So nobody can ever say, I have a Plan G and I have different coverages in my Plan G through Blue Cross Blue Shield to opposed to Oxford Plan G. The government mandates that. Everybody has the same coverage. You can pick the plan and the coverage that you want, and you can compare one insurer to the next, and you can pick that plan that has the best rate as well. Questions to ask yourself when picking a Medigap plan. What's your income? Using your customized Medigap report, you can shop for a Medigap plan that has the most benefits that will fit within your budget. Do you think you'll want or need nursing care? Look at your family's history, the medical history. If your parents or grandparents needed nursing care or assisted living care, you may also need similar care in the future. Do you travel a lot overseas? I know I do. If so, you can get coverage for emergency care in foreign companies with Plan C through Plan G and even M&N. Now, here's the thing, deciding between Medigap plans is pretty easy. Either, you're paying a higher premium for more comprehensive coverage, or you pay less for your premium, but potentially pay a little bit more out of pocket. It's sort of that risk and that gamble that you take. Secret number 2, Medigap plans is standard, but the rates are not. Insurance premiums can vary thousands of dollars a year for the same exact coverage. Here we have a female, age 65, living in Massachusetts. Plan MA, which is the most comprehensive. The highest premium is $2,469 a year. That same plan MA, the lowest premium is $1,295. So again, it's the same coverage, just 2 different insurance companies, one obviously charging more than the next. That's a savings of $1,174 a year. Now, most people who venture into Medicare at age 65, we knock on wood that we live at least 10 years throughout our Medicare, lifespan. If everything remained the same, no inflation, no nothing, that's over $11,000 savings. Just by simply going to the Osterville Village Public Library and just doing quick research and just getting the best rate and the coverage that you need. Let's take a look at a 68-year-old man living in Massachusetts. We're not even going to go with the most comprehensive Plan G. We're going to go even a little less with Plan A. The Plan MA highest premium is $2,894. That same Plan MA, the lowest premium is $1,710. That's a savings of $1,184. Again, almost a $12,000 savings throughout 10 years. That's if everything remained just stagnant. We all know that inflation and everything else never stays stagnant. So the savings here, honestly, you might even be able to double it. And that's the cost of like a compact car. I'd much rather drive around in a new compact car than give my money to an insurance company, simply because I didn't shop. Let's look at a couple. Female age 65, male age 68, living in Massachusetts. Plan MA, its highest premium combined for the 2 of them is $5,363. The lowest premium is $3,005. That's a savings of $2,358. And again, if everything was stagnant, no inflation, no nothing, we're looking at a savings of over $23,000. That is a brand new mid-sized car right now. And again, simply just because you did a little shop and it took you less than 5 minutes to do it, and Osterville, Village Public Library allowed you to do this because they subscribe to the tool. That's if Medigap is the most appropriate direction for you. How safe are your insurers? I mean, that's another very strong point. Not all insurance companies are created equal. The ability to pay, that's another big task for a lot of insurance companies. Weiss takes the homework away from you. A is considered excellent. B is considered good. C is considered fair. D is considered weak. And E is considered very weak. I always try to recommend stay away from D and E. Those are not good signs. Secret number 3, safer insurers are not necessarily the most expensive. Most of the times they're not. Higher premiums don't mean you're getting coverage from a stronger, more financially stable insurance provider. And the last secret number 4, you can make the choice. More coverage for less, reduce your premium, balance the financial safety of your insurer with your choice of plan. Again, we're going to go over those 4 secrets one more time. Medigap plans, they do offer the identical coverage across the board. Medigap plans is standard, but the rates are not. Safer insurers are not necessarily more expensive. And again, I'll say it over and over, more times than not, the safer insurers are actually less expensive. And you can make the choice. Weiss Financial Ratings Medigap reports, it helps you make the right choice for you in your specific situation. You can pick the right coverage. You can pick the lowest rate. You can save valuable time and money. And you can pick the best and most affordable plan from all available providers customized just for you. And you get it all for free because the Osterville Village Public Library subscribes to this helpful tool. And they provide that free for all of their patrons. Here are some common questions. Eligibility for plans C and F. If you were eligible for Medicare after January 1st, 2020, Plan C and Plan F and high deductible Plan F will not be available to you. If you were eligible for Medicare before January 1st, 2020, you can continue to enroll in Plan C, Plan F, and high deductible Plan F. In essence, you've been grandfathered in. If you're not eligible, you could also consider Plan D instead of Plan C, or Plan G instead of Plan F. The only difference, again, is that $233 Part B deductible. The solutions offered by Weiss Ratings Customized Medigap Report is to help you find and select the best Medigap policy for you with the strongest companies for the least amount of money. Naturally, every person's situation is unique. So if you have more questions, we urge you to, 1, I already mentioned this earlier on in the presentation, talk to your doctor about your future healthcare needs and make sure that the plan you are selecting will give you the coverage that you need. 2, talk to the insurance company that you selected to make sure that all of your specific questions are answered. You certainly want to make sure that any type of coverage that you need or any specific procedures that you need to have done are covered under that policy. And then the marksmen, the experts in the industry. You can also talk to a SHIP counselor. That's the State Health Insurance Assistant Programs counselor. You can call them, and that's to get personalized one-on-one Medicare counseling, or either over the phone or in person, and to help you further. You can locate a SHIP counselor in your own area by visiting this hyperlink that we have there. And again, we'll be sharing this slide base with everyone, so you'll have that. And once you go on to the shiptacenter.org, you can click on and find a local Medicare help. And if they don't have the answer for you, I just don't know who would. They definitely, without a doubt, they live and they breathe this day in and day out. How to get your own Medigap report? Well, you simply go to ostervillevillagelibrary.org. You go ahead and you click online learning button, and then you just hit the featured databases, and right underneath there you'll see Weiss Financial Ratings. Click right on that. All you simply do, if you're remote from home, just enter your library card and PIN. If not, if you're there in the local branch, just log right in and pull up your own report. I want to thank you for joining me today. Now, I'm not done. I really wanted to share an actual Medigap report with you so you actually see what it looks like. So I'm going to go ahead. I'm going to stop sharing this. And I'm going to go ahead and pull up another form here. Let's see. All right. Now I just want to get out of here. Okay, here we go. All right, so I just need the ability again, Lisa, to be able to share my screen. Let's see, here we go. Here we go.
Hold on a second.
I got it.
You are sharing. Okay.
So can everybody see the report now? I just want to make sure. Okay, great. So here we have a sample patron, age 65-year-old female in Osterville, Massachusetts, 02655. I ran this report back on November 7th. Okay. Now, one of the things that I wanted to run across is almost everything that you're going to see in the beginning of this report is some of the things that we actually went over in today's presentation. And as we scroll through, here's some of the key decision questions that you'll want to go ahead and ask before you go ahead and dive in and start looking at different plans. And then for me, one of the things that I always do is I always like to share stories. Now here you see, here's the inpatient care, the first 60 days. Medicare will cover all but the first 1,600. So we're responsible for 1,600. There's the $400 a day, the $800 a day. And then we go over absolutely everything here, skilled nursing care. And it'll tell us what does Medicare pay and what are we responsible for. And this could also really help shape on whether or not, you know, should you get a Medigap or should you do Medicare Advantage? You know, the choice is really, it's yours. But one of the things that I really wanted to show you as we go in is we go over everything from physical exam, wellness visit, even more obscure stuff like abdominal aortic aneurysm screening to bone mass measurements, breast cancer screening, cardiovascular. The list goes on and on and on. But, you know, one of the things that I always say is that, you know, when I was younger, you know, I was brought up in a middle-class home, and we had the matriarch of my house, which was my grandmother. Although my last name is Kilkenny, I'm actually 3/4 Sicilian. So grandma for us was Nana. She was a matriarch of the house, and you know, we again middle-class home. We had one TV in the house. I grew up in the 70s. Most middle-class homes only had one television. There was no such thing as remote controls. I was the remote control. One of the terrible things for me is that from the hours from 1 o'clock to 4 o'clock, I was typically home and I was the remote control. And I was subjected to the one TV, and we had As the World Turns, One Life to Live, General Hospital, so forth and so on. And, you know, my Nana every 2 minutes would say, "Hey, Tommy, change to channel 2, change to channel 4, change to channel 7. And I turn around and I say, "Hey, Nana, why do you have to know the subplot of every single one of these programs?" And she would just say, "Stop being fresh and change the channel." Respect our elders. That's what we did back then. And I just changed the channel and did it with a smile. But the one thing I can tell you is right around like 5 o'clock, the tides turn. You know, some of my favorite programming came on, and those were game shows. You know, you had my favorite Family Feud with Richard Dawson. And then you also had, you know, Jeopardy, you had Wheel of Fortune, and, you know, they always targeted the seniors. I don't know if any of you remember, they had Mr. Dreamy, Mr. Magnum PI, Tom Selleck with his blue eyes and his big mustache, and he's talking about reverse mortgages. And he even has my Nana sitting there like, "Oh my God, should I do a reverse mortgage?" And it's like, what are you talking about? Like, no, it's not right for everybody. But she would sit there in her lounge chair, and she had a coffee table off to the side of it. She had always a cup of coffee there. She had her Pall Mall no filter cigarettes, and you know, she had her prescription drugs, and she always had her notepad and pen in case she seen something on TV that she wanted to look at. And you know, But always, then all of a sudden you had Pat Sajak and Vanna White come on, and they started talking about, the Colonial Penn and Humana. And next thing you know, they're starting to talk about, Colonial Penn and Humana, and they're talking about the Plan G, most comprehensive plan where you only pay a $233 deductible and everything else is covered after that. Right off the bat, Nana's thinking to herself, you know what? My mother died at age 52. I'm really nervous if something happens to me, that I'll get stuck with a big bill. So she's tuned into, this plan MA, which is similar to the Plan G. Massachusetts is one of the only ones that does not have the 10 plans. They're Plan MA, Plan MA1, and Plan MA2. But so Plan MA is as close to Plan G as you're going to get. And so sure enough, Pat Sajak at the end says, well, if you want to call Humana, call 1-800. So, there's my grandmother. She's jotting it down to 1-800. And if you were like me, we only had one TV. We had no remote. We only had one telephone in the house. And that was in the kitchen with the 50-foot cord. And sure enough, Tommy, go grab the phone. I go run into the kitchen. I grab the phone. I run it back into the den. Go dial this number. I'm dialing in 1-800. And finally, she gets Humana on the phone, and they start talking about, the MA plan. And, the first thing she starts thinking to herself is, I can really only afford like $200 a month. I really can't afford to pay more than that. So all said and done, they tell her that, it's going to be $2,309 a year. So her Adam's apple bounces back and forth. And she said, I can't afford to pay that all at once. And they said, or you could do, monthly premiums of $192 a month. My grandmother says, well, all right, that's under $200. I'm actually saving $8. I thought I was going to pay $200. So she goes ahead and she binds the coverage. Oh, that Wednesday, she goes out. She plays bingo over at the American Legion Hall with her friend Trudy, and she starts telling Trudy that she's got this Humana plan, and she feels really good about it. It's full comprehensive coverage. She's only paying $192 a month, and she's all happy. And Trudy starts thinking to herself that both of my parents had physical ailments, and maybe I should get an MA plan, something very comprehensive. So she goes off and she says, you know what, I know that Osterville Village Public Library has a program that I want to do some research on. So Trudy goes and she runs, and she wants to run her own Medigap report. She goes ahead, 65-year-old female in Osterville, Massachusetts. The difference between Trudy and Nana is Nana listened to Pat Sajak and Vanna White, and Trudy actually did the research on her own. And the difference is now Trudy had all of these different companies to go to. And right off the bat, there's Blue Cross Blue Shield of Massachusetts. Everybody knows Blue Cross Blue Shield. It's got a B-. That's considered a good rating. And the annual premium is $1,295, and the monthly premium is only $108. And sure enough, there's the Humana insurance standard. It does have an A rating. It is slightly highly rated, but there's the $2,309, and there's the $192 a month. So Trudy, of course, the next Wednesday goes back and she tells my grandmother, hey, I got Blue Cross Blue Shield. And she says, oh, really? Okay. And one would think Blue Cross Blue Shield is probably more highly safety rated than Humana, but it's not. But sure enough, she says, oh, so what are you paying? And she says, well, I'm paying $108 a month. And right off the bat, Nana's like, all right, that's $84 difference. You can't have the same coverage. Well, she's 100% wrong. The coverages are the same. It's just the prices are different. And because Trudy actually went to Osterville Village Public Library and did this, she saved $1,014 a year. It's a lot of money. $84 a month she's saving every single month. To some seniors, that's a utility bill. Sometimes that's 2 utility bills for seniors. Just because Osterville Village Public Library subscribes to this service for you guys, and you guys can go shopping. That is if the Medigap is right for you.